If you click this video away, please tell me what it was so that I can improve. Otherwise, hi and welcome. I am trying to learn medicine today, Aspergillosis, and after that Ataxia, and after that stretching. And if you participate in the stretching, then is that at your own risk. And we're talking a bit about the internal anatomy and medical conditions. And this is no medical advice. We're just reading about it and we try to understand it. Aspergillosis, a fungus infection of the lungs and airways caught from dead leaves, compost heaps, hay, and other decaying vegetation. Okay, there is some type of fungus, can be somewhere in leaves, compost, or something else in the garden or in the field. And if people breathe these spores of a fungus in, then they can get aspergillosis. And that is an infection of the lungs and of the airways. Now I don't know if it is something typical for leaves, but it is not written here for leaves, but I would think that it is not usually in heaps of leaves. But I want to point that out, that I don't know, but it could be that it is something general in leaves or in hay, but it might be that that is only in special cases. Yeah. Okay. It causes asthma and recurring chest infections and can be diagnosed by skin or blood tests. Okay. It seems if people get aspergillosis through an infection of a fungus which can be in leaves or in hay, that can cause them to develop asthma. So I think they don't say here asthma as a symptom, but I think they mean it permanently. We did one asthma in the previous part, I think. Causes respiratory infections may cause inflammation of the tubes, allergy to certain substances ranging from the house dust meat to animal fur or feathers in pollens or foods. Nocturnal attacks in children are often associated with house dust, meats, down pillows, or pets sleeping in a child's bedroom. Anxiety or excitement seems to precipitate attacks in some people. Asthma is a word which often conjures up a frightening picture of patients fighting desperately to get their breath. So it is understandable that many parents may be apprehensive when they hear their child wheeze. But wheezy breathing is common in young children and usually does not indicate that true asthma is present or will develop later. Asthma occurs when the small bronchial passages in the lungs become swollen with inflammation, partially obstructed by phlegm, or narrowed when the muscles surrounding the air tubes become tight. Asthma tends to run in families. True asthma is a respiratory problem, but the symptoms may be confused with cardiac asthma, which occurs at night in older patients. Asthma may appear for the first time in childhood or in adolescence, often as an extension of hay fever. Is hay fever now aspergillosis? I would say not, because we don't say it. But I don't know. It can also appear out of the blue later in life. This so-called late-onset asthma, which can be much more disabling than other forms and is often associated with recurring chest infections. So I can say it causes asthma and recurrent chest infections. Recurrent chest infections, that seems like that these aspergillosis changes something in the lungs permanently. Not just one time when asthma or a chest infection, but people get this infection from the fungus aspergillosis and then they can have asthma lifelong and recurrent chest infections lifelong. That is what we get from it. That is what I understand from it. We stay a bit away from it when we are doing our presentation and just saying as we say it, it causes asthma and recurrent respiratory infections. And again, this is no medical device. I'm just reading that and trying to understand it. And it can be diagnosed by skin and blood tests. If caught by a patient already ill with a serious malady such as leukemia, it can be fatal. Okay, Aspergillosis, now we're trying to make a little video about it. Aspergillosis, it is a fungus infection which can be caught into the lungs and airways through dead leaves, compost heaps, or hay, or other decaying vegetation. It causes asthma and recurrent chest infections, and it can be diagnosed through skin and blood tests. If a person has already a malady or a serious illness, for example leukemia, then they can die of it. Okay, Aspergillosis. Now, we have information, so I have a second camera which I'm going to start now, and then I try to save it. Aspergillosis, that is a fungus infection into the lungs and airways, and it comes from dead leaves and compost heaps and from hay and vegetation which is rotting away. Now, and it causes asthma and recurrent infections, respiratory infections. It can be tested through a skin and blood test. If the person who gets it has already a serious illness like leukemia, it can be fatal to them. That is according to Keith Hodgkin's Family Medical Advisor book on the page 79, but this is now medical advice. I'm going to stop the camera. And we're having our second part. We don't really have time left, but let's do it. Ataxia. Ataxia is a symptom of many different diseases affecting the brain and spinal cord. The patient moves clumsily and frequently loses his or her balance. Ataxia is treated according to its cause. Okay, we're going to stay away in our presentation. These are just free informations. We're going to stay away from the third information that it is treated according to its cause, so that the cause is treated. That makes sense. We're going to say the two things. It is a symptom, and it is moving clumsily and frequently losing of balance. And that is because through diseases which are affecting the brain or the spinal cord. Ataxia. Okay, I'm going to start the camera again and I'll try to save it. Ataxia. It is a symptom of many diseases which are affecting the brain or the spinal cord, and the person moves clumsily and loses frequently their balance. And that is according to Keith Hodgkin's Family Medical Advisor book on the page 80, but this is now medical advice. Hardened arteries. I'm going to stop the camera. Now, and that was the medical part. If you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the stretching, then it's better at your own risk. We're having the feet standing together, and we're opening one toe to one side, the other one to the other side. And again, this was no medical advice, which is what we just did. And if you participate here, then it's better at your own risk. Toes to the outside, heels to the outside, heels to the outside. As far as you can go. And now all in again, one at a time. And now you stay on the same level with the head, so you go into the knees. And up. Now the legs shoulder wide apart, maybe a bit more. Breathe in and lift the arms up. And breathe out and go over to one side. Breathe again in and come into the middle. And breathe out and go over to the other side. Again in, out and down. Breathe again in. Out, slide with one hand the leg down until the upper shoulder stays down. Breathe again in. And breathe out and bring one arm over. Breathe in and out the rib cage. And breathe out back into the middle. Breathe again in. And out, one hand slides down the leg and the upper shoulder stays down. Breathe again in. and out one arm over. Breathe in and out the rib cage, and out back into the middle. Have the feet standing together, breathe in and lift the arms up. And breathe out one hand down. Breathe in and reach. And again out. In and reach high. Out and one hand down. Breathe in and reach. Out, hand up, bow down. Now the legs again shoulder wide apart, and we're doing shoulder circles. Go back with the shoulders up, in front, and down. And into the other direction. In front, up, back, down. One more time. And now breathe in and lift the shoulders up. Breathe out, let them fall down. Again in. Out and down. Breathe in and lift the arms up. And reach always with one hand high up. Pretend to take an apple hanging high on an apple branch, to turn it a bit around and then to pluck it out. Now, legs wide apart, arms up to a T. Breathe in. And breathe out and shift just the upper part of the body over to one side. Again in. And out over to the other side. Again in. And out, we're leaning onto the knees. Breathe again in. And out on one shoulder in front. In and back. Out and front. In and back. Out and front. In and back. Out and front. And back. Breathe again in. And out, and we're hanging down. Breathe again in. And out, go over to one leg. Breathe in. Out over to the other leg. Breathe again. Out into the middle. Close the feet, but keep on hanging down. Breathe again in. And out. Again in. And now out, come slowly with a round back up and back at the top of backwards, shoulder round. The torso pointing to the outside. We're having an ulnar length space between the heels, and breathe in and lift the arms up. Now breathe out and sink down, and place your elbows against the inside of the knees. Breathe in and straighten up. And breathe out and come with the leg up. Breathe again in. Out and down. Again in and straighten up. And another time out and down. Breathe again in. Out and down. And now breathe in. And out and come slowly in one straight line upwards. And your hands again down. Last exercise, have a good standing leg. The other leg with the heel on top of the knee of standing leg. Breathe in. And if you can do it without injuring yourself, you breathe out and go slowly down. And again up. Change the legs. Breathe in. And out and go down. Again up. And back. Have the legs stand wide apart. Breathe in and go down. And breathe out. Again. Out. One more round, breathe in, and out, again in, and out, and now breathe in, and close the legs, and breathe again out. That was the stretching. I thank you very much, and to the next time.